Hi, my name is Grace Turner, and today I'm going to talk about healthcare, specifically healthcare in the United States, and why it is so different here versus in other countries. This topic is important to me because it affects everybody in the country, regardless of if you think you're healthy or not. At some point, you're going to require healthcare. Um, for me personally, it is very important to me because I am a type 1 diabetic who has to get my own insulin. And in the past, I've had a long standing medical history that has caused me to be on a variety of medications and require a variety of medical procedures. Some of my medications that I have been on have costed upwards of $18,000 per infusion. So this is a topic that has affected me personally and my family personally for a long time. Healthcare in America is very different from other countries. America is the only first world country to not provide healthcare for all of their citizens as a human right. In America, we have privatized insurance that typically is added on when you get a job. So you can buy into insurance there. So a lot of people that have a job have health insurance, but if you don't have a job, it is harder and much pricier to get insurance. Privatized insurance is very expensive and is only available to those that are privileged enough to be able to afford it. Even if all citizens in the U.S. were covered by private insurance, that still would not improve health outcomes in the U.S. because not all private insurances offer good coverage to their customers. Many insurances won't cover the cost of birth control for their clients due to religious concerns. That's with more Catholic institutions that is an issue. But this leaves many women who require birth control, not only to prevent a pregnancy, but many women are also on birth control to prevent endometriosis symptoms and deal with ovarian cysts and things like that. Without that birth control, which is very expensive on its own, they cannot manage their diseases and live their lives in pain. Drug prices in America, to make things worse, are significantly higher than they are in other countries such as England or New Zealand. Insulin prices, especially, are significantly higher in America than they are anywhere else in the world. People in the UK are able to get a vial of insulin for less than $100, whereas people in America are spending upwards of $300 on insulin in some cases. When I personally have had to go buy insulin, if I have not hit my insurance deductible, it could be upwards of $800 for one prescription. It's pretty ridiculous, which leaves a lot of diabetics having to ration out their insulin or just stop taking their insulin if they can't afford it, which leads to death in a lot of cases. Diabetics especially cannot live without their insulin. It is the only way their body gets it because they are not producing it on their own. The healthcare disparities in the U.S. Are often felt by poorer people and people of color in this country. Black and brown communities were the most affected by COVID-19, with the majority of deaths reported being from Black communities. Health disparities go much farther beyond just this current pandemic. Black women especially face higher risk of dying during childbirth than white women are. And that's not just because of healthcare in America, although that does play like a very big role. Part of that is just due to medical racism, which is also a glaring problem in this country. But still, Black women are more likely to die in childbirth than white women are. Also, Black and brown people are much more likely to die as a result of diabetes and hypertension because of gaps in healthcare. They can't afford to go to the doctor, they can't afford to get prescriptions filled, they can't afford a hospitalization, so they don't go. And that causes people to die much more frequently than if they would have insurance and they could afford medical care. In other countries, healthcare is much different. It is provided to every citizen as a human right. So if you're a citizen of that country, you are getting healthcare and you do not have to pay for it. This is much better because a lot of people, if they have a serious medical diagnosis, they either face bankruptcy because they can't afford their care, or they face death because they can't afford their care. Either way is not good. It puts a lot of additional stress on the patient, on their family, and it just makes it hard for everyone. In the UK, citizens can enroll in something called the NHS, which is the National Healthcare System. Service. Although this service covers all medical expenses and patients are not billed for their healthcare costs, this means that the people do not have to pay for medical expenses including hospitalizations, medications, and doctor's visits. The system allows it so that regardless of a person's medical history or financial background, they are able to get covered with no additional cost falling to themselves or their families. A common argument against universal healthcare is that many people will have to wait much longer in order to be able to see the doctor, and in some instances that is true. But in countries where they have nationalized healthcare systems, they say they don't mind because they know that they are not going to have to pay to see their doctor. And to wrap things up, healthcare is a human right, and no one should have to face bankruptcy or death because they cannot afford to pay for the cost of their care. And America is the only first world country in the nation not to provide healthcare for all of its citizens as a right. And as a result, people are dying because they can't afford the treatment they need.